My name is Heather. I'm going to be your nurse today. I just came in your room and I did my hand hygiene. We're going to go ahead and do a central line dressing change on you. We have our patient, Mr. Watermelon. His birthday is July 10th of 2008. We identified him. I'm going to tell him we're going to change his central line dressing change. And I'm going to ask him to turn his head. I'm going to put a mask on him so you don't breathe on your dressing while we're doing it. I'm going to grab my clean gloves. My order is to change your dressing. Hold your dressing, your central line. I'm going to slowly take the dressing off. I'm going to make sure that the central line has not deviated from the place that it was placed at 6 millimeters. It's not deviated from the port site. Site looks clean and dry, no redness. We have our 3 different ports. We have our white one, which is our proximal, where we can draw blood from. We have our blue one, which is our medial, which we can put viscous substances through, like chemo medications, or vesicle, my bad. And then we have our reddish brown one, ours is orange, that we can put viscous stuff through, like lipids. Take my gloves off. I'm going to do my hand hygiene. I come over here. I'm going to ask Mr. Watermelon if he's allergic to any shellfish, iodine products. He's not. I'm going to get my surgical mask on. I'm going to ask him to keep his hands down, not touch anything. I have my 1-inch border that I'm allowed to touch. And put my sterile gloves on. My dressing out. I'm allergic to iodine, so we're not going to use iodine. Open our alcohol swabs. Then clean. Clean from the inside out so we don't introduce any new bacteria. You doing okay, Mr. Watermelon? All right. Last one, I'm just going to clean down the catheter. Gonna let it dry. I'm just going to dry it off. You allow it to air dry. You have some skin prep to save his skin. We'd go ahead and do that around where we place the skin. I'm going to put the dressing on now. Gotta move his mask. Okay. I'm gonna leave the little bit of the ends of the ports out. Then I would stick this on there with my initials, the date, and the time that it was changed and who did it. All right. I'm gonna go ahead and take my gloves off, do hand hygiene, clean up our mess. Mr. Watermelon, we're gonna do a blood draw now from you, from your central line, okay? All right. Just fixing his mask. All right. All right, Mr. Watermelon. I'm going to check your orders. You do have for blood draw. I would get a pair of clean gloves, which I just have some sterile ones, so I'm going to get, they would be clean. I'm going to identify my patient, Mr. Watermelon. His birthday is July 10th of 2008. I'm going to put my clean gloves on. We're going to draw the blood from the white port, which is our proximal port. This is where it's going to be the cleanest, so that's why we'd want to draw blood from there. All right. All my supplies here. I'm going to go ahead and open my alcohol. We've cleaned the proximal or the white tip for 1 full minute. Make sure there's no bacteria that you are introducing. All right. Then I'm going to go ahead and get my flush. I'd unclamp my tube and I would flush in 10 mLs of normal saline, just slow. And then I would clamp that back off and disregard my normal saline. And I'm going to grab my empty syringe and I would unclamp it and I'm going to draw back 10 mLs. I'm going to clamp my tube back. The first 10 mLs of blood you do have to waste in case there's any heparin left over, normal saline. Go ahead and waste that. Then I'm going to grab my empty, another empty 10 ml syringe. I'm going to unclamp, pull back my 10 mLs of my blood. I'm going to go ahead and clamp my tube back, put my blood into my containers. Then I have my flush again. I'm going to unclamp. I'm going to flush with my normal saline. Then I'm going to clamp that back. And then I'm going to grab some heparin if it's your protocol from there. Get my heparin and I will flush with that. Then I'll go ahead and put my green cap on there to make sure that it stays nice and clean. All right, Mr. Watermelon, you did great. Take my gloves off, and I would perform hand hygiene, and I would be done.